Welcome, everyone. Thanks for bearing with us as we get started. We had a few technical difficulties, but we're really happy to have you with us today and to present another webinar in our ASQ Innovator Series. Today's webinar is showcasing how the state of Delaware has implemented a statewide screening initiative using ASQ. So I'm Amy Klaus, Marketing Manager for Early Childhood Products at Brooks Publishing. And today we have a trio of professionals from Delaware joining us. Jenny Grady and Jamie Walko from the Delaware Department of Education and Diane Frenzel from the Delaware Readiness Teams. So Jenny, if you'll move forward one slide for me. Before we start, I just have a few tips for listening to our webinar. We recommend you close any applications that take up bandwidth just for a better viewing experience. We will be taking questions at the end, so you can type those into the question box as we go. Let's see. We also have slide handouts uploaded in the handout section. There's also a URL in the chat if you'd like those. We are recording today's webinar, and you'll receive a link to that recording in a follow-up email tomorrow. You'll move one slide forward. I just want to let everyone know that we'll have a survey. So we really love hearing feedback from attendees. So if you'll share your feedback, we'll be picking one person to win a free book. And then the next slide, you will be receiving a certificate for attending today's webinar. So there's a certificate in your handout section right now. We'll be showing a URL at the end for those of you who are watching the recording. And if you're listening live, you'll receive that in a follow-up email. Okay, so now I'd like to introduce you to our three presenters. Jenny Grady is a technical assistant with the Delaware Department of Education, Office of Early Learning, leading the Developmental Screening Initiative. Mrs. Grady currently oversees Delaware's ASQ Online Enterprise account and serves as the facilitator for the implementation of Delaware's Developmental Screening Initiative, providing free screening to all Delaware children. Previously, she worked in deaf and hard of hearing early intervention as a classroom teacher and family educator, then served as the Education and Disability Coordinator for the First Start Delaware Early Head Start Childcare Partnership. Jamie Walko has been involved in special education in Delaware for 44 years, with 24 of those years specifically dedicated to early childhood. She currently consults for the Office of Early Learning as a technical assistant and has been involved in the ASQ initiative in Delaware since it began in 2013, providing ASQ training and technical assistance to all childcares in the state. Most recently, she has been an active member of the Learn the Signs Act Early State Team and the Early Childhood Comprehensive System Sprint. And Diane Frenzel is the program manager of the Delaware Readiness Teams, an organization that convenes families, early learning providers, school representatives, and community members to ensure that children ages birth to 8 are ready for school and life. In her role, Diane provides leadership and management for the Delaware Readiness Teams statewide. And prior to joining the Delaware Readiness Teams, Diane worked as a childcare director at Bright Horizons. So welcome, Jenny, Jamie, and Diane. We're really happy to have you here with us today.
Great. Thank you for that introduction. Jenny, Jamie, and I are really excited to be here with you today to share Delaware's Developmental Screening Initiative. This has been many years in the making and many partners involved, and there's also lots of work still to come. So some of the things that we're going to share with you today is the history of Delaware's developmental screening. We're going to learn how stakeholders and parent input led to changes. We're going to provide you with a better understanding of the current state of Delaware's screening initiative. We're going to explore how Delaware Department of Education is gearing up for full implementation of the new legislation. And then you'll also learn a little bit more about how data and information from ASQ screening results is used to drive family outreach and activities. So I want to begin by sharing a story with you. This story highlights our path for our developmental screening journey that really put the family voice first and had an impact on change. The story is about a grandmother who recently got custody of her grandson because his mother was incarcerated. Delaware Readiness Team members met this grandmother at a community event at a local elementary school, and she was looking for any resources to keep her 3-year-old grandson active in learning. She expressed how much she loved her grandson and wanted to do everything to help him succeed. She picked up a flyer from our table with information about developmental screening and said, "I think I need to get my grandson screened." She shared that both of them are still adjusting to the new arrangements, but she noticed some developmental areas that she questioned if he needed more support in. She also shared that her children were all grown up and she forgot what children this age should be doing. She asked if we could help her get ASQ screening for her grandson. And that is when the reality set in. At that time, ASQ developmental screening was not available to everyone. It was clear that ASQ developmental screener and the social emotional screener tools were perfect for this grandmother to not only identify if her grandson needed additional support, but to also help her better understand what is developmentally appropriate for a 3-year-old and how she can support learning. So Delaware Readiness team members vowed at that moment that this just couldn't happen. All families deserve access to developmental screening. At that time, there were efforts underway as a state to increase developmental screening, but the reality is that this grandmother and her grandson didn't have the time to wait. The Delaware Readiness teams wrote and received a grant from Highmark's Blueprints for the Community. We set up an online portal that any family could have access to ASQ screening tools. We created outreach materials and organized one message for families on where to go to get screening. We created a website that connected families who already had access to those screening tools and used our portal for anyone that did not have access. The beauty of our Delaware story is that it didn't stop there. This was just a stepping stone in our screening journey, but never forgetting this grandmother and the thousands of families out there just like her that want to do the best to support their children. So now I'm going to turn it over to Jamie, who's going to share with you a little bit about what was happening at the state.
Thank you for being here today. When I began as the ASQ Technical Assistant in 2013, screenings were only available through some pediatricians. Some school districts were sending screening teams to child care to administer screenings, and screening events were also being held for incoming kindergarten students. Most districts were using the dial screening, which is a paper screening, and the Birth to 3 program didn't have a screening protocol. Little communication between physicians and districts or state agencies regarding screening was occurring, and there was little new data available. Our QRIS system, called Delaware STARS, began in 2013. Developmental screening was one of the many standards that was going to be addressed through this initiative. In 2013, Delaware brought Brooks in to provide a train-the-trainer training for the various state agencies. Easter Seals was contracted to coordinate the trainings and distribute the ASQ kits. So after the child care providers completed the training, they were given the kits. In 2018, developmental screening became an essential standard for all of the high-level programs, meaning the 4- and 5-star level programs, and required all programs that were using the ASQ to do so online using our online enterprise system. Still, we had a limited number of screenings completed. This slide shows the process that was used during 2013 through 2019. If a program was working on the developmental screening standard, every child that did not have an IFSP or an IEP needed to be screened to get credit. The families completed the screening. The child care scored the screening, reviewed it, and then worked with the families to make referrals, or they made the referrals on behalf of the families with the parent consent. We monitored this progress and found there were major challenges. Child Cares reported that they were making referrals to state agencies, but no follow-up occurred. The state agencies were reporting that they never received any referrals on the ASQ, based on the ASQ. And only children participating in Delaware STARS programs had access to screening. Once again, limited data was available. We decided we needed to come back to the drawing board. Here you can see all the different entities and influences we needed to consider while revising the developmental screening process. The Early Childhood Comprehensive Systems Grant was in place at that time, and they were looking at the screening data in the state and how they could unify our state early childhood program. The Delaware Readiness Team was surveying parents, and they found that many parents were unable to locate developmental screening for their children. Based on this information, the Readiness Team received a grant, and they opened up their own ASQ account. This led to a discussion at our early childhood special education meeting regarding the district processes for screening and how it could be expanded and included. One thing was for sure, the districts wanted control of screening decisions. First, we wanted all the districts to use the same screening tool. So we wanted them to use the ASQ. Not all districts were on board. Some were not interested in using the ASQ, and they were very happy to continue with their dial on paper. Our colleague, Dawn Alexander, visited many different districts and explained the benefits of using the ASQ. She explained it was less costly than a screening team, data would be available to assist decision-making, and money that was saved could go towards direct services for children. After months of discussion with various agencies, this process was developed to address the challenges. The Birth to 3 program and all of the school districts entered this voluntarily. All screenings were reviewed by either Birth to 3 or the LEAs. Those agencies would then share the results and follow-up activities with families unless the child care completed the screening. If the child care completed the screening, they were then responsible for contacting families with the results and the recommendations. Districts would post their screening links on their early childhood website and invite all families to participate. You no longer needed to be involved in a child care. And we were excited that we were opening the door to provide access for all children to receive screening in the state of Delaware. Screening links were posted and the Delaware Readiness Team on the Delaware Readiness Team and the DOE website. Looking back, I wish we had more input from child cares and families. Some of the child cares voiced concerns that they had lost control over the developmental screening, while others noted that they were relieved that they didn't have the capacity to complete the screenings in the beginning, and now they would be assured that the children were getting screened and they would receive the appropriate follow-up. All entities were told at that time that this was a process and that further revisions would occur as needed. Now we needed to disseminate this information about the changes. We created a one-pager and an infographic which synthesized all of the information about the process. I would attend various meetings. I attended child care meetings and Delaware STARS TA meetings. I presented at Advocacy Day for the state. And I also wrote a manual, one for the child cares, school districts, Birth to 3. And in those manuals, it gave specific step-by-step directions and provided all of the necessary forms. At the end of summer of 2019, Jenny and I recorded training for child cares that also provided step-by-step directions. The fall of 2019 came, and we were so excited that we were implementing our new process. I began to monitor the districts and the Birth to 3 to make sure everything was going smoothly. I was also checking to make sure screenings were being reviewed within that 2-week timeline. DOE was talking about how we could plan to expand the screening. We knew we had to open it up to all child cares and all children, and that we were still missing children. And we decided that we would gradually include all child cares. First, we had the 4 to 5 Delaware STARS programs on board, then we would move to the 1 to 3 programs, and then we would open it up to the remainder of the licensed child care. Districts began interacting with the child cares, they were implementing the process, and we had no idea what was going to happen next. Little did we know that in March 2020, COVID would hit and that everything was closed down. Now I'm going to pass it to Jenny Grady to explain what happened next.
During the pandemic year, we continued to forge forward with our screening initiative. In July of 2020, I joined the team as the new technical assistant, and Jamie continued to support us during this transition. She stays on the team and is highly involved as our subject matter expert. Our goal during the pandemic year was to continue the use of our revised system, as well as continuing to work towards our goals. This included continuing to enroll our new providers and to provide the Department of Education produced screening resources, as well as technical assistance to support using the online system in a way that worked for our state. We also collaborated with the Birth to 3 Early Intervention Program to oversee their portal responsibilities and partnership. This included revising their reviewer manual as they contract with 211 Help Me Grow to review their screenings. We also updated their results letters to be more family friendly, and then offered ongoing support to the Birth to 3 Early Intervention Program and 211 Help Me Grow to learn and follow Delaware's system. We updated the Department of Education Developmental Screening website to include more resources, as well as a single point of registration for providers and an inquiries link. We refined the reviewer manuals, and as this initiative grows and changes, our materials must grow and change with it. We began our reviewer community of practice, which still continues, and we continue to support our LEAs to post our developmental screening information on their early childhood websites. Here is a flowchart to take a look at the intricacy in our reviewing and follow-up system that we use for our enterprise account. Our reviewers are responsible for reviewing the screening information, working with the families to make appropriate referrals, and assigning the screening to the provider classroom for the child cares to access screening results with parent consent. Although the Department of Education was moving forward with their plan to onboard all lower-level STARS programs and licensed child cares, families needed support faster, and therefore several grassroots initiatives began occurring. Advocates raised concerns to the local legislatures that despite the department's efforts, not all children had access to developmental screenings. Advocates also pushed for all license-exempt programs to be licensed through the Office of Child Care Licensing, which will require them to complete developmental and social-emotional screenings. Both of these conversations resulted in 2 bills passing: House Bill 202, which is the Developmental Screening Bill, and Senate Bill 169, which is the Delaware Child Care Act. Both are slated to go into effect July 1 of 2023. The House Bill 202 will require all licensed child cares to use the state system for developmental and social-emotional screenings. Thanks to this legislation, the Department of Education is now responsible for overseeing the state's developmental screening efforts. In preparation of this, the department is ramping up their website to be a one-stop shop for information and resources for all families, reviewers, and providers. You can see here a screenshot of our current website listing all of the districts and our Birth to 3 Early Intervention portal links, as well as their program links. You can also find a support request for the single point of registration, as well as the inquiries link. The department is responsible for housing the ASQ online enterprise account and is fiscally responsible for the upkeep of that account, including for paying for the cost per child per screening. The department has also been tasked with developing a statewide implementation plan with the focus on scaling up our current system with 300 providers currently participating to support our 1,100 and growing licensed childcare programs we currently have in Delaware. Our implementation team is comprised of about 20 participants from various stakeholder organizations, included but not limited to the Office of Child Care Licensing, Department of Education, Head Start, our LEA representation, Child Care Center representation, Family Child Care Input, Birth to 3 Early Intervention Program, Department of Public Health, and several more. Our goal is to determine what is working well, as well as to identify our gaps, and to create a plan for our scale up using the current system. We also are going to determine our funding and capacity needs to support the sustainability of this project. In order to accomplish this, a high level of communication must occur. It is an ongoing, constant process to revise and update manuals and materials to better reflect best practices for implementation, as well as provide uniform materials and messaging. These include sample forms for districts and providers to use, including invitation letters, release of information form, a consent to communicate form, partnership agreement, and other forms and materials that might be helpful throughout this initiative. There are a variety of ways that we share this information in addition to it being housed on our Department of Education Developmental Screening website. The LEA reviewing agencies have access to this information, the manuals and forms via Schoology, and the Birth to 3 Early Intervention Program works closely with their contractors at 211 Help Me Grow to share information regarding reviewing and managing their portal. Providers receive their manual as a part of the orientation email that they receive when they register for the ASQ Online Enterprise account. We are continuing to revise the website with the intent to be our one-stop shop for all reviewers, providers, and families regarding developmental screening. We are continuing with our community of practice for our reviewers. Our community of practice includes our LEAs, our Birth to 3 Early Intervention Program, and the 211 reviewers. We meet bi-monthly and we focus on using our system with fidelity as well as the uniformity of our messaging and materials. This is also a really great place that's provided so that we can have a space to support each other. In order to create our state implementation plan, 2 groups have been established to accomplish this work. The core implementation team has already begun meeting, and we meet bi-weekly to drive our exploration and organization of our state implementation team. That is slated to meet monthly. Sharing this information will occur through several actions. We have a creation of a current user email list for the current users and providers that are within the system to receive updates as well as opportunities. We also have the opportunity to host provider calls as well as webinars to address changes and updates, and then ongoing collaboration with our Office of Child Care Licensing to share information to all licensed providers to support their onboarding to the ASQ Enterprise account. There are many known gaps that we must address between now and 2023 for this initiative to be successful, all of which we know will help increase student outcomes. Working with the state implementation team will help us plan how we will fill these gaps. In regards to tracking referrals, although the Birth to 3 Early Intervention Program has a robust process for tracking referrals, this is not happening across the board for all reviewing agencies. We will continue to work with the reviewing agencies to determine their process for tracking and following up with referrals and supporting them as necessary. In regards to training, it is evident that we need more training opportunities for families, providers, and reviewers. Families need guides to help complete the screening and better understand the purpose of developmental screening and monitoring, while providers need orientation on how to collaborate with families in order to complete the screenings, as well as the understanding the importance of screening and monitoring and the use of the online system. We will need to address regulatory changes and update internal regulations to monitor the completion of the use of ASQ and using our system with fidelity. This will include determining funding needs to support the scale-up and sustainability of our statewide system to be used with fidelity at the provider, reviewer, parent support, and evaluation levels. While this continues to occur at the state level, we are still using our ASQ data to drive our community events. Now we'll hear from Diane Frenzel about how the Delaware Readiness Teams uses our statewide ASQ data to support families within their communities.
Thank you, Jenny. So before I get into discussing how we're using the data, I just wanted to remind everybody, I know we had as part of the introduction, but the Delaware Readiness Teams are a statewide initiative of volunteer-based teams that bring together early learning professionals, school representatives, community members, families, all to help children birth to age 8 get ready for school and life. So next slide. Because our Department of Education has created this master ASQ portal, this has really allowed us to look at developmental screening data across the state in different counties and even in our local communities. Community partners use this data to inform programming with outreach to children and families. And we've really looked at this data and focused on children who fall in the monitoring to reinforcing area. So we know our Part B and our Part C programs are working hard to support the children that fall in the possible referral for additional assessment area. So we wanted to make sure that we support children who don't qualify for these services to get information and resources to help support reinforcing skills. So for Delaware, we noticed that our biggest areas of need fell in the areas of communication, fine motor, and problem solving. And there are many partners that are working to support. And so I'm going to share a few examples of what the Delaware readiness teams are doing and how we're using these ASQ scores through community outreach and information sessions, literacy kits that support the Dolly Parton Imagination Library Initiative, community birthday celebrations, and kindergarten academy events. So the first thing is community outreach and information sessions. So I think it's important to give you a little bit of background that the readiness teams focus in on 4 main areas. First is kindergarten readiness and registration. And this is making sure children will be ready ready to learn on the first day of kindergarten and enrolled. Also, healthy children and developmental screening to increase screening and, according to the results, provide families with the resources and the services they need to support. Family empowerment is another focus area so that families will increase their knowledge of child development and implement activities that support learning and growth, as well as advocacy. So that's advocating for the family voice so that policy reflects what is best for children and their families. Our voice has had an impact on the developmental screening bill that was just passed. So we also focus on outreach and distribution in the community. We share materials based on the needs of families and also needs that are collected from the data. We do this by providing developmental milestone information, developmental screening postcards, kindergarten registration information packets, books with reading tips, books, literacy kits, school supply bags, developmental learning bags, all kinds of different ways that we reach these families. And we do it also at various locations. So anywhere from community events to community centers, food distribution sites, state service centers, our bookmobile, through our libraries, our childcare programs, our schools, our churches, and as many of you know, in the past year and a half, a virtual platform as well. So next slide. So next I want to talk to you a little bit about the literacy kits for supporting the Dolly Parton Imagination Library literacy. The state of Delaware is fortunate to have the Dolly Parton Imagination Library program available to children statewide. This program is available through the Delaware Division of Libraries and is for children from birth to age 5. And what it does is it mails a new book to children each month. So while children are receiving this book, we wanted to make sure that we provided them with an opportunity to engage them in learning along with the book. So we partnered with the Rotary Club of Wilmington to create and distribute literacy kits that contain materials and activities related to the first book that every child gets from the Dolly Parton Imagination Library, which is the book, The Little Engine That Could. We used ASQ data specific to Wilmington to target areas of need, and we created 2 separate kits, one for children for birth to 3, and the other for children 3 to age 5. An example of the activity sheet that we used is shown here on our slide. And what we really did is took these different materials and the different learning domains and explained how you can utilize these materials to skill build for each one of those areas. These bags are available in English and Spanish and contain community resources such as developmental milestone pocket guides and information about reading aloud to children. We also created videos with instructions on fun ways to use the materials, and they are being shared. We are piloting these kits with several locations, including local childcare partners, New Direction Early Head Start, a pediatrician office, and a local library to get feedback and try to scale. Next, I want to share with you a little bit about the community birthday celebrations. Last year, the readiness teams partnered with Christiana Care, Delaware's largest healthcare system, to host virtual community birthday celebrations with Let's Play. These child-centered events are focused on fun, friendly, skill-building activities that support developmental milestones. The celebrations were held for 1- and 2-year-olds and a separate events for 3- and 4-year-olds. All participating children were mailed a birthday gift to support the learning at home. And the activities at these community birthday celebrations and the materials mailed all focused directly on the identified areas of need from our ASQ scores. The community birthday celebration model does continue to evolve. We recently worked with our Birth to 3 program to develop a resource bag and a community birthday celebration event for the children that were in their program. The resource bags were distributed and a celebration event was held, and it included a story and interactive activities that actually included unpacking the materials in the bag and explaining how children could use those at home. Next slide. I also wanted to share with you information about our Kindergarten Academy events. The readiness teams have been working with the Department of Education's Office of Early Learning to develop a framework for a Kindergarten Academy model that can be used throughout the state. This Kindergarten Academy is designed for families with 4-year-olds who will be entering into kindergarten the following school year. The Kindergarten Academy features a collection of objective-based lessons reflecting on best practices used in early childhood education and parent information piece that explains learning supports for each area. Past Kindergarten Academies have been held in person. While children participate in learning stations, the parents participate in an information session on the topic for that evening. Parents also have the opportunity to observe their children participating in the activities and then come back together for an activity as a family. The children who participate all received a bag that has supplies in it reflecting that topic. And all of these materials were explained during the parent session. So when the COVID pandemic hit, this made us pivot to a virtual Kindergarten Academy series. And we continue to do that with this including a live virtual session for children, a pre-recorded parent information session, a follow-up list with materials and resources that were used during the session, a checklist on how to support learning at home for this area, and materials were also mailed to children following the academy. Now we are gearing up for our 2021-2022 Virtual Kindergarten Academy, and this is going to be held the second Tuesday from November to May. And we will also have, new this year, the Academy will be held the following Wednesday in Spanish. Topics include social studies, social emotional, health and safety, language and literacy, science, math, and easing transitions into kindergarten, with a focus on how children can use problem solving, fine motor, and communication in all of these areas. So I know I just shared a lot of information, and all of this information can be found on our website, www.delawarereadinessteams.com, and I'm happy to answer any questions you might have. And to wrap up our presentation, Jamie, Jenny, and I wanted to share that the developmental screening journey continues as we refine our system. It started with voluntary participation in the screening process, leading to a more formalized, systematic approach. We continue to engage stakeholders in the continuous improvement process while keeping families at the forefront of our thoughts. As we began our developmental screening journey, we are committed to continue to do what is best for children and their families. Thank you.
Great. Thank you, Diane, and Jenny and Jamie. I have just a few slides to cover, and then we'll go ahead and take some questions for the Q&A. But if you have a question, go ahead and type that into the questions section of your webinar panel now. I wanted to make sure that all of our listeners are familiar with the ASQ website, which is agesandstages.com. There's really a wealth of free resources available. There's a resource library that's searchable by topic. There's a networking directory, and there's a training portal. So I encourage you to check that out if you're not already a registered member of the site. Now on the next slide, I have another reminder about our short survey. So a survey, as you leave the webinar today, the survey will pop up, and there will also be a link in your follow-up email tomorrow. So we would love to have your thoughts and ideas for future topics of webinars. And I'll say if you are interested in presenting one of our ASQ Innovators webinar, definitely fill out the survey and let us know, because we're always interested in sharing more stories of how ASQs being used around the country and around the world. So here is the information about your certificate for attending today's webinar. So if you're listening to the recording right now, go ahead, you can pause it and jot down that URL and then go and get your certificate. For those of you listening live, you also can use the link that's on your screen. It's also in your webinar panel. It's in the handout section, and you'll receive a link in tomorrow's follow-up email. Okay, so now we will go ahead and take the Q&A. I'll take some questions. Jenny, you can go forward one more. I think the slide with all of your contact information is up there in case anyone wants to jot down any of your contact information. Okay, let's see. We're getting lots of nice comments about good presentations, and thanks for sharing all of our information. We have a question: is the DOE ASQ Online site accessible to healthcare providers in your state?
That is a great question. I can field that one. The ASQ Online portal, the way that we have it set up is through every district and Birth to 3 Early Intervention program actually uses a family access portal link. So although the pediatricians do not have access to have their own portal, they can definitely help support families to complete it using the appropriate portal links.
Okay. And related question, are the healthcare providers informed of the screening results or informed of referrals that are happening? Is there any link between, I guess, the patients in a healthcare practice and their screening results?
At this moment, there is not a connection between the ASQ system and pediatricians. However, this is something that is on our radar. So as this initiative continues, it's an area that we do want to explore.
Great. We have a nice comment. It says, great presentation, and your efforts seem rooted in the little engine that could. I think I can. So we had a question, so related, the same listener saying, Diane mentioned that many resources are available in Spanish. Are most materials and web interfaces described by Jenny and Jamie also available in Spanish or any other languages? So I guess the screening portals.
Yes, so all of the districts and Birth to 3, they do offer their screening portals in English and Spanish, and then they also do have other language options that are offered through Brooks that they do have access to, as well as the materials that's provided in the manual. Anything that we have to be shared with families, we do have it translated in both English and Spanish.
Okay, great. Let's see.
And feel free to jump in.
Sure. We have a listener asking, can you talk about how some child care providers complete the ASQ versus some parents complete the questionnaires themselves? Is it true that both is happening?
That's a great question as well. So although we do recommend that best practice would be that the family completes it, so that's obviously, you know, the first rule of thumb that we do want to be following, we do have some scenarios that our child cares are completing it on the parent's behalf. When they do that, they are required to complete a consent form to have written consent on file from that family, giving them permission. And of course, it also has to be a teacher that is with that child for over 20 hours a week. The main way that we kind of encourage the child care providers is that best practice would be that we would want them to be sitting there with the family, completing it side by side. And we're working on creating some opportunities for some of those kind of guiding opportunities for those families, but we definitely have some child cares that are completing it on the parents' behalf, and they simply do the same thing that the families do. They follow the family access portal link, and then they complete the screening there just like the parent would.
Great. Okay. We are getting actually we got a message to repost the certificate information. So Dan, if you could go ahead and put that in the chat for me in the URL, if you have, if you could pull that from the slide handouts, that would be helpful. Let's see. We have a listener asking, is there an audio version of the ASQ in case families are not able to read the questions, or videos to show the activities in case families don't understand? So I'm not sure if that's a question about Delaware specifically or broadly, but there's not an audio version of ASQ available and there aren't like videos embedded in the ASQ online system to show activities. Both of those are excellent points. And they would definitely be great features that we have talked about adding and would like to add at some point. So I don't know if Jenny or Jamie, if you've created any of those videos to help families or anything in Delaware.
Jamie, would you like to speak to some of the projects that you're working on?
At this time, we don't have any videos to assist families in completing the screenings. However, I'm currently involved with Learn the Signs Act Early, and we have created a training that we're going to be going out and providing. We have it in English, Spanish, and also in Haitian Creole. And it's going to be talking about the importance of developmental screening, monitoring developmental milestones, and also explain how you could get involved with how you actually get into the ASQ website in order to complete the screening here in the state.
Thank you. We have a listener asking, have you had a large increase in Help Me Grow EI identification rates or at the LEA level since you started the screening initiative?
That is a really great question. Because of COVID, that did derail a bit of, how many children were being screened. We are looking at that information now and compiling some reports to get some more specific data around tracking referrals and the increase of those services. So at this moment, we don't have that information, but we're working towards it.
We also have a listener asking, do you know approximately how many online screens are being received through your initiative in like a yearly basis?
I would have to go back to take a look at the data. I know in September, we had roughly 1,000 screens that came in through the portal. So that's just this past September. I would have to take a look at the annual data and I can get you those numbers.
Okay, just curious. I think we're having some Delaware listeners who are asking some specific questions about how they can get set up and how they can get connected. So for those of you who are listening, we'll share your questions and your names with the Delaware presenters so they can have more of a personal, and people are asking for some updated referral information in Delaware. So we'll connect you.
Absolutely.
Take this now.
Feel free to go to the website that's listed under Jenny Grady's name. That'll take you directly to our developmental screening website where you'll find the single sign-on or the single point of registration link on there and some information. So that should be able to kick you off.
Okay, great. We have a listener asking, are your home visiting programs in Delaware connected with this initiative at all?
Great question. Yes, all of our home visiting programs, we have portals right now for them. So it's all of our districts, birth to 3, and then right now all of our home visiting programs do have their own portal that they are managing. All of their data does synthesize and come through our enterprise account, but we're going to be working on strengthening those relationships.
Great. We have a listener, we have a couple people have asked, so if the parents fill out a screening and they're in a child care program, does the child care program receive the results of the child screening, or how's that connection work?
Yes, as long as the parent, when they are completing the screening, as long as they note the child care provider, we did add a custom field to the child profile area that's specific for them to notate their child care or preschool. As long as the family notes that on there, then yes, once they are reviewed, the reviewers will assign them to that child care's classroom, and then they'll be able to view the results.
Okay. We also have a listener asking about 211 and Help Me Grow. They noticed that on the flow chart, looks like for the birth to 3 was connected with 211 and Help Me Grow. Can you talk about how Help Me Grow is connected with your initiative and what piece they're responsible for?
So Help Me Grow is contracting with our Birth to 3 early intervention program. So 211 Help Me Grow is overseeing and completing the reviewing for that family access portal. So what they are doing is they're kind of boots on the ground reviewing those screenings and then using the materials that we've created to combine to send information back out to the families. And then 211 works with Birth to 3 to track their referrals as well so that nobody falls through the cracks.
Okay, great. And I think one of your colleagues has typed in, I'm putting it in the chat now, it's a link to your, I think it's like your main web portal that has information about developmental screening. So I just put that in the chat box. So if any of you listeners are interested in seeing that URL, it's in there now.
Thank you.
We have a listener asking about training plans for childcare centers. So as providers, see the results, is there training for childcare provided to help them understand, screening and the results that they get?
Jamie, do you want to take that one?
Sure. Okay. Yes, we have a training program. So we have trainers that attended the Train the Trainer through Brooks, and our trainings are offered through DIEEC, which is our program through the University of Delaware. It's quality assured. So people can go on to the calendar of DIEEC, and they could then sign up to have to participate in a training. There are two different trainings. The first one is the introduction to the ASQ 3 and SE2, and then the second training is on interpreting the trainings. We do plan to update these trainings in the near future as we move this initiative forward.
So we have a general question on, so as you roll out this bigger screening initiative to all the licensed childcare, are there efforts underway to ensure services and resources and supports are available in the future to handle what's expected to be, more children identified?
That is definitely a point that we're going to need to be working with our state implementation team and, working on a plan towards that. So at the moment, I don't have a great answer for that.
Right. Okay. And are you requiring both ASQ 3 and ASQ SE2, or is it just ASQ 3?
Yes, it's both the ASQ 3 and the SE2.
Okay, great. Let's see. And then could you talk a little bit about, do you do any rescreenings if a child scores in the monitoring zone, or is there a regular schedule that you encourage parents to come back to rescreen?
So if a child scores in the area that a rescreen is necessary, then that information is sent back to the family on their screening report. So there's a results letter that will say this is how your child scored in the different areas, and then this is the recommended follow-up. And within that recommended follow-up, it'll note, rescreen in 3 months or 6 months, however long the rescreen needs to occur, and then it'll also have the link to follow up. We also encourage families and providers to collaborate and work closely together so that the child care providers can also help support those families complete the rescreen when they're due.
Okay. We have a listener who's asking, do you have any suggestions for when programs have roadblocks with local school districts to getting them to follow up and process screenings? Do you have recommendations for working with school districts? Since you're on the other end.
Jamie, you've worked very closely with all of the districts to start this initiative. Do you want to talk about that a bit?
Well, one of the reasons that we started our first initiative, actually, now that the school districts and Birth to 3 are the ones who are responsible for reviewing all the screenings and following up, they actually have that information in their hands. Previously, you had the child cares who were reviewing the information, and then they needed to make the referral. But now that the school districts and Birth to 3 are actually the ones making the referrals to themselves, We are hoping that that is helping to alleviate some of the problems that we've had in the past. Because of COVID, we just got our program off the ground, and then COVID happened. So, we're still working out the kinks.
Great. Okay. Could you explain more about the developmental screening bill and the advocacy and partnerships that went into that helped lead to that legislation being adopted?
Absolutely. Diane, you were highly involved in this. Would you mind answering that?
Sure. So Jenny did mention earlier about House Bill 202, which is going to expand access to developmental screening for all children that are attending licensed child care programs from across the state. So as she mentioned, beginning in July 2023, all child care programs will be required to provide annual developmental and social emotional screening for children that are age 5 and who are not enrolled in kindergarten. So with screening, it's very important that all children get screened. Studies show 90% of a child's brain develops before the age of 5. And so it's really important that we identify children that might have delays or disabilities in these critical early years. Research also shows that children who do qualify and receive early intervention services are more likely to be successful readers. They're less likely to continue needing special education services later in life. They're more likely to have improved social skills, and they're more likely to graduate from high school. So in Delaware, our pre-COVID statistics showed that about half of our children were in licensed childcare programs. And so this bill will significantly help us increase the number of screenings that are going to occur, which means we're going to reach more children earlier and either identify them for the services that they need and qualify for, or utilize the multiple community resources to help children who don't qualify for services but fall in that monitoring area and need additional support for these skills. So all while collecting data so that we can better understand how we can support these children. So special thank you to all of the legislators that helped with this bill. It is the first like it in our nation. And so we're very thrilled for it. And then to touch on the partnership piece, as far as partnerships, we mentioned earlier that partnerships from all over made this initiative a success and where it is today. And that's in partnerships that was building the system and, as of today, partnerships that are scaling the system. So Jamie mentioned all of the partners that are at the table, the state agencies, the nonprofits, for-profits, your businesses, your civics organizations, your funders, people from the education sector, people from the health sector, readiness teams, including families, our early learning providers, our school districts, and even ongoing support from Delaware's First Lady, Tracy Quillen Carney, who actually is joining us today here. So you've heard the expression, it takes a village, and we thank everybody in our village and want the message really to be that you have a village too, and get to know your village, because when everybody works together, really great things can happen.
That's great. Great. We have a couple more good questions. There have been lots of excellent questions. So we'll take just a few more before we sign off. But so Diane, I think this question is for you. You talked about some of the resources that the Delaware readiness teams had created and they were giving to parents. Was there a milestone pocket guide that you mentioned that was available? Is everything available on your website?
So the pocket guides that we have, Delaware actually has a website, DE Thrives, and they actually have materials that are available. That this is through public health that has this, and they have all of these outreach resources that are available. And we go on there and we ask for those, and we have those to distribute out in the community. So we're very fortunate to have that. And we also want to make sure that as we're reaching families, we're explaining to them what is developmentally appropriate. And so these have been a great resource to use.
Okay. And so DE Thrives is where those milestone pocket guides are available. So I think if our listeners just Google Delaware Thrives or DE Thrives, you'll find their website. We have a question, what supports have been successful for families that have literacy challenges or those that lack access to technology? Have you found ways to support them?
That is one of the areas of need that we've identified and that we're going to need to strengthen through partnerships. We do have some ideas of using like a parent-to-parent guide, organizations that we have in the area or other supports in that sense. So that is definitely something that we are working on and coming down the pike.
Okay. And I think this is a great question to end on. If you had unlimited resources, what would you do to improve access to screenings?
That's a really good question. If I had unlimited resources, I would make all the trainings in the world and be able to offer them at maximum capacity as many times as possible for families, reviewers, and providers. I would bring people in to come and speak and really make a robust system around it, as well as really supporting the website to be extremely interactive and robust to be able to be accessed from anywhere. And then I would also want to work collaboratively to see about putting some programs or events together to be able to get screening out more so that more families have access. And then we also have people there to be able to help with some of those issues of, low English proficiency or, not being able to have internet at home, all of those different issues that come into play that really prohibit families to be able to complete the screening. I would want to break those barriers down and provide opportunities. Jamie or Diane, did you guys have anything that you wanted to add?
I was just going to say that I think one of the barriers that we have found is that we really do need to provide more support to families. I think that if we could have parent navigators so that they would be out there to work with the families in order to complete the screenings, that would really make a big change in the number of screenings that are completed with fidelity. I think that is the one area that we need to provide the most support.
And I agree with both of them. I see with the Delaware Readiness teams being out in the community, lots of opportunities to do that at food distribution sites, at state service centers, having people there to support the families that have trouble filling that out and to really help guide them along, I think would be really helpful as well.
Great. Well, thank you so much for your presentation. It was really interesting to hear how all the work that you're doing in Delaware and where it started and where it's going. And thank you to everyone who joined us today. We're really happy and hope you enjoyed our presentation. So we hope everyone has a great rest of the day. Bye-bye.